This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel, broadcasting remotely. COVID-19 created a global health crisis. Thanks to scientists, people are starting to get vaccinated. But the pandemic has shown the U.S. how unprepared it was for dealing with the last year. Today, Where We Live, after years of underfunding, will policymakers do a better job investing in public health and its workforce? Coming up, we'll talk to a recent graduate about his career decision to work in public health, and we'll hear from a community health worker. First, to give us an idea of how local health districts have been operating across the country, joining me now on Zoom is Michelle Smith. She's a reporter for the Associated Press covering public health and the pandemic. Michelle, welcome to the show.
Thanks for having me.
Also with us on Zoom is Jennifer Kertanis, Director of Health for the Farmington Valley Health District, and she's board president of the National Association of County and City Health Officials. Jennifer, welcome back to the show.
Thank you very much.
You can join our conversation, 888-720-9677. That's 888-720-WNPR, or you can share a comment on our Facebook page. You can find us on Twitter, @WhereWeLive. Michelle Smith from the Associated Press, I'll start with you. You and your colleagues started investigating the state of our nation's public health system during the pandemic. In your story, I wanted to quote, "On every level, the system is underfunded and under threat, unable to protect the nation's health." Describe what you found. Did any of it surprise you?
It was surprising. I think that public health, many people knew that public health wasn't getting the money it needed and had been cut many times over the years, but just the extent of it leading into the pandemic was very surprising. So AP and Kaiser Health News teamed up for the investigation, and we found that spending for public health departments and local health departments had really plummeted since 2008. 16% per capita for state public health departments and 18% for local health departments. Nationally, in Connecticut, the staffing at the State Department of Public Health per resident dropped 16% before the pandemic. Connecticut spends about $61 per person on public health at the state level. That is nationally, we found that about 3/4 of Americans live in states that spend less than $100 per person annually on public health, and it's just again and again the people we spoke to who are public health experts who are working in public health on the ground and dealing with this pandemic have said it's just not enough money to do what needs to be done. And we can see that now with the vaccine rollout, that it's very slow in many places, and the technology isn't there, the staffing isn't there, they just don't have the resources they need to do their jobs well.
You were talking about funding over the last several years. Something else that struck me in your story, Michelle, at least 38,000 state and local public health jobs have simply disappeared since the 2008 recession. So this leaves a skeletal workforce that we're seeing here in our state in terms of the challenges of finding people to run these clinics, to have volunteers, to do contact tracing. Can you talk about how our public health system is structured across the country?
So there's the federal, on the federal level, there's the Centers for Disease Control. Then you come down to the state level, and every state has a public health department or some department that manages public health. They're called different things in different states, and every state seems to manage to organize it a little bit differently. Then within states, public health is managed in different ways. Some states have just one state health department. It does public health for the entire state. Other states have local health departments that might be based either in towns or in counties or in regions or like sets of counties. So it really depends, and it's kind of a grab bag of ways that public health is done on the local level. Some states, have state offices that are spread around the state that do public health. Other states don't do that. They just have one state health department. So it's really different depending on where you are. Then, what public health departments do is there are so many different things that they do. It could be mosquitoes, monitoring mosquitoes to make sure things like Eastern equine encephalitis aren't found and aren't spreading. They do programs on opioid addiction. There's so many things. Maternal health. They do a range of services for communities to keep the population healthy. And it's different from what doctors and hospitals do, who treat individuals. Public health departments they're responsible for the health of the population in their community.
To get a local perspective on what Michelle Smith was sharing with us, again, I wanted to bring back into the conversation Jennifer Kertanis, who's Director of Health for the Farmington Valley Health District. Jennifer, talk about some of what Michelle has shared, how you have seen resources shrink over the years and how our health departments are structured in our state.
Sure. So Connecticut does have local health departments because we don't have a county government structure. We have either standalone municipal health departments. So our larger cities in general have a health department that is kind of built into the municipal infrastructure of that city. We also have kind of regional health departments. So they're called health districts, like the Farmington Valley Health District, where multiple towns come together and receive their public health services protections through this district health department. In Connecticut, local health departments are funded in a number of ways. One, we receive a per capita allocation from the state legislature. Currently, that dollar amount is $1.85 per person. So for probably less than half the cost of a cup of coffee, that is the investment right now that the state is making in local health departments, $1.85. In addition, health departments obviously at the local level are supported by the municipalities they serve, whether they are a municipal department within a city, or if you're a health district, we kind of levy another per capita allocation, and our towns contribute that money to us based on the population of the community that they have. And then fee for service. So local health departments do charge for things like restaurant licenses, permitting fees, installation of septic systems, septic repairs. So that's another source of revenue for health districts. We have not seen any kind of increase in the state investment in local governmental health for many, many, many years. And in fact, we've seen decreases for the past several years. That state per capita allocation has been underfunded by, I think it's about 10%. So yes, the disinvestment in our local health departments has been historic and longstanding.
Michelle, when we talk about these departments being under-resourced, why is that? And is it there the idea that when emergencies happen, like a pandemic, that the federal government will step in and send some emergency money to states to deal with the latest crisis? And I'm just wondering if you could talk about the cycle that's been seen as recent as the Obama administration.
There's a few thoughts on that. One of the things public health people like to say is that when they're doing their jobs well, nothing happens. And so when they're able to do, what they need to do, no one's going to notice the outbreak that they prevent. So that is a challenge for them because, people just don't notice when they're doing their jobs. Another thing that has happened repeatedly is a boom and bust cycle. So some sort of outbreak or epidemic hits, and there's a bunch of money thrown at the problem, often too late. And then once it's over, the money dries up again. And it's happened again and again with past, H1N1, swine flu, things like that. And then the money dries up. And there are various programs, for example, on the federal level, that have just never been fully funded or were cannibalized for other things. Something a lot of people have said is, all right, we're in a pandemic right now. There is some money coming to it, although arguably not enough. What's going to happen when it's over? Is the money going to dry up again and not be there for the next pandemic that hits? And just going back into the bust cycle with no money to hire people, no money to train future epidemiologists. And then, in however many years, we'll be back where we were at the beginning of the coronavirus pandemic.
Jennifer Kertanis, this COVID relief money sent to Connecticut, has it trickled down to local health departments and health districts such as yours?
It really hasn't. My health department has received $176,000 for this fiscal year through something called the Epidemiology and Lab Capacity Grant. This is pass-through money from the CDC to the state, but $176,000 for the type of response that we're mounting, that hardly allows me to hire a full-time equivalent if you think about a salary and benefits. And we are incurring considerable costs associated with supplies, vaccine refrigerators and freezers, supplies to run clinics, overtime to do contact tracing, overtime to run clinics on Saturdays to vaccinate our teachers. So it has not trickled down to the local level the way it needs to.
Today, we're focusing on public health, not only the public health workforce of the future, but how public health departments around our country, including in our state, have been underfunded and the consequences of that, especially in this pandemic. You just heard Jennifer Kertanis, Director of Health for the Farmington Valley Health District. She's board president of the National Association of County and City Health Officials. And also with us, Michelle Smith, reporter for the Associated Press, covering public health and the pandemic. Michelle, I brought up the Obama administration earlier because in your reporting with Kaiser Health News, I believe under the Affordable Care Act, there was a particular public health fund that was established to have billions to help with these initiatives, but that money was then raided by the Obama administration and Congress. What happened under the Trump administration?
Well, I mean, it's just the same the same story. At the beginning of the pandemic, towards the beginning of the pandemic, there was some money, the CARES Act. Everyone knows the CARES Act set aside a lot of money for the pandemic. But, in our reporting, we looked at that CARES Act money and where it went. And while some did trickle down to local health departments, there were some places, that never saw anything. They got nothing. Some local health departments got $0 fighting the pandemic. And it put them in a very difficult position. So it just kind of surprising, I guess, that in the middle of a huge public health emergency, the biggest one our nation has had in over 100 years, many public health departments were still scrambling and scraping and putting stuff together with bubblegum wrappers and pieces of string to help their communities.
Jennifer Kertanis, you gave us an idea of what the state spends and how that money is sent to health districts such as yours. Is there anything in the governor's budget proposal to help health districts or coming from the State Department of Public Health for these next couple of years?
Well, ironically, there is a hearing today at the Capitol or via virtually the Appropriations Committee. And my understanding is that the governor has proposed in his budget level funding of local health departments. So I presume that's at the $1.85 per capita. And obviously, my membership organization and others are advocating for a relook at that and reconsideration about the investment that we need to make in local public health in Connecticut.
What would be a reasonable per capita expenditure, Jennifer? The $1.85 seems pretty low.
Oh, geez. That's a tough question to ask, but years ago, we at the Connecticut Association of Directors of Health did an evaluation. I just would want to back up and say to Michelle, to comment on something Michelle was saying is, it's a well-funded, well-staffed local health department that is prepared not only for an emergency, but for everyday response. And so, as she spoke to, it takes a cadre of diverse disciplines, epidemiologists, health educators, community outreach workers, public information officers, and communication experts. When a health department locally has that expertise, we are better positioned to deal with the public health threats and issues we deal with every single day, as well as a pandemic. And so many years ago, we looked at what it would take to fully fund and staff a local health department with the myriad of expertise and disciplines we need. And I think at that time, and it was, many years ago, that per capita was about $20 per capita.
$20 versus $1.85 per capita, which it is now.
Right.
Jennifer, again, you lead the Farmington Valley Health District, so you're coordinating with towns in the Farmington Valley. This is the week where I think it's 600,000 more Connecticut residents are eligible to sign up for the vaccine. So there's obviously you're working around the clock, I assume, you and the people in your department. But what does that mean in terms of what would be adequate staffing to help you through this surge in vaccine appointments? Yeah.
So when we started this pandemic, my department had just hired an epidemiologist, a part-time epidemiologist. That was a godsend. That is what has allowed us to track and monitor what is happening with this disease in our communities, who's at greatest risk, where we need to prioritize our efforts, and to assist with the contact tracing. We didn't have a communications person, still don't. We didn't have extra staff to do contact tracing. So we had to bring on first volunteers, and now we're able to pay a little bit for that support. We don't have community health outreach workers. We do not have public health nurses. And so, we are having to rely on the incredible goodwill of the 10 towns that we work with and volunteers. all of our community vaccination clinics, and we do 3 a week, and now we're starting to gear up for Saturdays for our teachers, are all volunteer driven. We could not do that work without them. The other thing I would just comment on is that my staff, like in the environmental health arena, or in community health, so the work that we were doing around youth vaping or the opioid crisis, or mental health or chronic disease prevention, and even some of our environmental services, all of those folks have had to be redirected to focus on the pandemic. So a lot of that work is not happening, or certainly not happening at the level that it should. And we're going to be struggling with those issues long after this pandemic is gone. And some might argue that we'll actually have more significant challenges in those areas when the pandemic is over.
Michelle Smith from the Associated Press, before we let you go, when we talk about the workforce, especially in the pandemic, this is a workforce that in your reporting and your colleagues, they're obviously underpaid, so much so that some are on public assistance, but they're doing important work. I'm just curious if you could talk a little bit about that, the stress and the fact that they are underpaid.
Yeah, that was one of the most surprising things was that we found with the number of people who do this public health work. They work for your local government in many places, who are actually on public assistance because they are paid so little. And it's in addition, like with the pandemic, one of the things that has happened is in many communities, they have become public punching bags. So, they've been flamed on Facebook, and some of them have been threatened, driven from their jobs. We counted 181 public health leaders around the country who resigned, retired, or were fired from April 1st until December of last year. There's just a ton of pressure on public health workers these days, and it's not always appreciated. The work they do is not always appreciated by their communities.
Michelle Smith, again, is reporter for the Associated Press covering public health and the pandemic. We'll tweet out some links to her stories along with Kaiser Health News looking into the public health workforce in the United States. Michelle, thank you for your time today.
Thanks for having me.
This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Jennifer Kertanis will stay with us. She's Director of Health for the Farmington Valley Health District, also Board President of the National Association of County and City Health Officials. Coming up, we talk about the systems in place to support community health in a pandemic and beyond. You can join us too. Find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Today we're taking a ground level look at public health. Your local health department does more than schedule and staff COVID-19 vaccine clinics. Public health workers manage disease outbreaks. They work to protect us from environmental health threats. They also inspect restaurants. They respond to emergencies. Then they provide important outreach and education around community health. But we just heard that public health around our country is so poorly supported, from low salaries to persistent cuts in local government funding. Will the pandemic change how policymakers view public health priorities? We're talking about that with my guest on Zoom, Jennifer Kertanis, Director of Health for the Farmington Valley Health District and Board President of the National Association of County and City Health Officials. Jennifer, before we hear from a community health worker, I wanted to ask you your reaction to what Michelle Smith had shared about the fact that during this pandemic, there's a lot of anger directed towards public health officials that are just trying to do their jobs, like inspect restaurants if they're not following COVID-19 protocols. Have you seen and heard this from your colleagues here in our state?
I have, less so in our state, but certainly in my role as president of the National Association of County and City Health Officials. We've really watched in, dismay, some of the challenges that our colleagues have had, either losing their jobs or being threatened. It is, a pandemic is something new for everyone, and everyone has their own personal perception of risk. People are scared, people are anxious. And there is certain uncertainty, especially in the early days of this pandemic and before we had vaccine, and even uncertainty now for some with respect to when they might be able to access vaccine. And unfortunately, local health departments have been kind of the focus, or local health leadership has been the focus of some of this frustration. Mostly, I think, born out of, anxiety and people not knowing exactly how best to protect themselves, when they might get a vaccine, how they might protect family members, what truly puts them at risk, what doesn't put them at risk. So understandable, but at the same time, public health professionals went into this profession not for the money, not for the notoriety. We went into this profession because we wanted to help people. We wanted to be public servants. And so that aspect of this has been, very frustrating to watch.
Mm-hmm. Again, I mentioned earlier about the large number of Connecticut residents who are now eligible, and the stress it's putting on the system that's in place to not only schedule a vaccine, but knowing that the supply doesn't quite meet the demand. But there's a lot of stress also in our state about the importance of equity. The governor's saying that it is a greater priority in this next phase of the vaccine rollout. But I'm wondering if you could share some of your perspective when we hear how understaffed and underfunded public health departments are, Jennifer. Does that make you think, too, that we don't have the tools on the ground to make sure that this is as equitable rollout as possible?
Yeah, I think that, when we think about communities of color, communities living in poverty, they are probably also served by local health departments that have not been well funded, that maybe don't have the resources they need to do the outreach. They may have a workforce that is not reflective of the population they serve for a whole host of reasons. So equity is a very challenging issue. I think one of the other things we have to think about is we are so driven right now by volume and making sure that shots get into arms, which is important. But we cannot do that at the risk of recognizing that certain populations are more challenging to reach. They may not have transportation. They may not speak English as their primary language. They may have childcare issues which challenge them to get to available public clinics. They may not understand or have access to some of the technology that has, at least early on in this pandemic, been driving who can access vaccine and who can't. So as much as it is important to get vaccine into arms as quickly as possible, we also really need to recognize and appreciate that there are segments of our population that will take extra time, extra resources, extra outreach, and we need to prioritize that as well.
Mm-hmm. Again, you're hearing Jennifer Kertanis, Director of Health for the Farmington Valley Health District here on Where We Live. One group that could be key in reaching this population that Jennifer mentioned are community health workers. Joining us now on Zoom is Fatawu Mahama, community health worker with Southwestern Area Health Education Center in Shelton, Connecticut. Fatawu, welcome to the show.
Thank you for having me.
So tell me about what you do specifically with your organization and how you have been working in this pandemic.
Yeah, so at my agency, what we do at this point is equipping community health workers to really understand what the COVID-19 is all about. and also providing the resources to help them to be able to navigate within the community to help their clients. So in the process, we are able to provide community health worker trainings around COVID-19 to our CAW training participants. We are also in the process of developing another vaccine competency training, vaccine confidence training to community health workers based on a survey we just concluded last week. And from that survey, we're able to have information from the community that indicates that there's a lot of misunderstanding within the community that has to do with the COVID-19 vaccine. And also there's a lot of barriers, like Jennifer mentioned. There's a lot of barriers on either technology, people having trouble traveling to where the vaccination is given. And also people just able to navigate to set up appointments. So these are all information community health workers are being challenged with within the communities they work in. And that's what we have been working hard to kind of get information across to help them understand how to support their clients in these cases.
We know that COVID-19 has taken a priority, and now vaccine efforts with the COVID-19 vaccine finally available. But does this also put a stress on community health organizations, Fatawu, when we think about all the other things they're responsible for, and they almost have to be sidelined because we're dealing with this pandemic?
Yes, for our agency, knowing very well that our services are geared towards underserved communities within most part of the state. We have been really challenged with reaching individuals because most of the programs we provide initially they were in-person programs, but then now we have to kind of change everything online. Even with the trainings we provide for community health workers, we have to kind of modify it to an online training. So that's a bit challenging, but at the same time, it's an opportunity to kind of explore other kind of options to be able to support the community in these difficult times.
I understand a lot of the programming around community health workers is done on a grant-funded basis. So is that also challenging, Fatawu, when you think about how funding will dry up in terms of the outreach that you and others are doing?
Absolutely. Yeah, definitely. I think part of the challenge we community health workers have always faced is funding. Most of our positions are funded by grants. We are never part of either the agency budgetary allocations. And when the budget ends or when the grants end, then our programs ends as well. And then we are left hanging. And our clients are left hanging as well. And during this COVID, I think is part of the reason why most of the challenges we are facing is increasing and of course in a lot of disparities within the communities, because the systems that were supposed to be built were not built, and then the systems that were supposed to be sustained were not sustained. And that is why I'm so happy that Jennifer really mentioned about how they are using volunteers, and most of these volunteers, I did hear that most of them are also on public support, public assistance programs. These individuals are just individuals who are willing to support their communities, and they are community health workers in some sense. And if you take that into consideration and then establishing a system that sustains some kind of funding to support these individuals, you can imagine where the health of the state will go. And just being there as community individuals, and then knowing that they are more connected to the community than even some of our professionals within the agency that we work in, these individuals are able to bring us to a level that we sometimes never thought of getting when it comes to the community health.
We've heard our governor often look to our neighboring states to work together as a region in this pandemic. But I'm wondering, Fatawu, are there examples of other states in our region that are investing in community health right now that could be models for Connecticut?
Oh yeah, definitely. There's a few states that has really done well when it during this COVID. Chicago, for example, when COVID hit, they also hit the ground running. And while they were hosting town hall meetings around the state, there was a focus on community outreach whilst collaborating with community health workers, providing COVID-19 testing outreach services like door-to-door, showing up at grocery stores, and laundromats, including making sure that locations where essential workers are located have been visited. With this effort, they have been able to increase the number of people who historically never had any kind of connection to a healthcare provider, develop some kind of relationship with a provider, and that they boosted their state COVID-19 testing and as compared to other states. New York also, they also did a very good job using, and this is part of the information that is being shared. This is part of a CAW team at the New York Presbyterian Hospital and also the New York University of Grossman School of Medicine. So they joined their hands together to kind of provide some kind of awareness program when it comes to COVID-19. And they reached out to over 9,000 individuals within the community. And that's just providing over the phone, like wellness checks, helping nearly 3,000 individuals enroll in online patient portals, prepare for upcoming appointments and all of those stuff. And with these interventions, they were able to even uncover and took action to address social determinants of health disparities affecting these individuals during this COVID-19. So definitely some states have done well in working with community health workers, but the story still remains the same. I don't think there's a sustainable funding because for community health workers, all of these states are working under grant-funded programs or are working under voluntary kind of community health worker models. And knowing the impact or the outcomes of community health workers' work within the community, I think, and not myself just thinking, there's a lot of literature out there that really supports that there should be some kind of sustainable funding for community health workers and also some kind of sustainable model that incorporate community health workers within the healthcare system.
Fatawu Mahama, again, is community health worker with Southwestern Area Health Education Center. That's in Shelton, Connecticut. That's where he runs the organization's immunization program, but also connects and develops training for other community health workers in Connecticut. Fatawu, thank you for your work and your time today on the show.
Thank you for having me.
This is Where We Live. I'm Lucy Nalpathanchel. Here's some good news. Public health programs in the United States have seen a surge in enrollment during the pandemic. We're going to talk about that coming up and take your questions too. Find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Today we're talking about the importance of public health. Now, there are reports enrollment for public health workforce has increased in the pandemic and in graduate programs. Joining us now is a recent graduate on the phone, Tim Clufus, who has a public health certificate from Yukon Health. He's currently working as a contact tracer and is a member of the governor's vaccine allocation subcommittee. Tim, welcome to the show.
Thanks for having me.
Also with us on Zoom, Jennifer Kertanis, Director of Health for the Farmington Valley Health District. So, Tim, I understand when you first started your graduate work in public health, you probably expected to learn about epidemics, but this is quite the learning experience for you this past year.
Yeah, I actually have a fond memory of our first day of classes. We talked about the Spanish flu, and it was, we hope to never relive another one of those pandemics, and hopefully we have our groundwork in place and that we've learned lessons from our past. But it seems clear that we have still a lot of work to do. And fortunately, our programs are really doing a good job in trying to stress the need to not only grow our funding, but also grow the people interested in public health, which is tremendous.
What motivated you to study public health, Tim?
So I'm actually applying to med schools now, and to be honest with you, the whole foundation of any medical care starts with public health, because without healthy communities, the medicine only works so much, because our surrounding communities that we live in, our environments, our social standings, and just the place we're put into has the biggest structural determinants on our entire health, which is why I felt it was important to have an understanding in public health if I want to become a physician.
Mm. And while you were studying remotely, you've also been working as a contact tracer. I remember when the state was asking for volunteers to help health districts and local health departments. Can you talk about the work that you've been doing? What has it been like?
So, yeah, it was interesting how I actually even got into it, because I had COVID in April while I was starting to study for finals and stuff. And it's like, until you have it, you don't really understand it fully. And I was hit hard by it. So UConn offered a course to train our grad students in contact tracing. So I ended up becoming a contact tracer. And I'd say it's probably been one of my more rewarding experiences I've done, just because the wide array of people I talk to every day. It just shows how diverse we are as a state, and the issues that you wouldn't think people go through every day are struggling, and trying just to help them any way you can is really impactful.
How do you think this pandemic has shifted even your classmates' perspective on public health, and maybe furthering their interest in public health as their future careers, Tim?
I think it's been a multifaceted thing. I think the pandemic was one part of the shift in interest, but I think a major surge happened with the events with the death of George Floyd and those issues that have caused a giant interest in focusing entirely on equitable health distribution, and also the need to really break the system that is causing our underserved communities to exist in the states they are. We've been having it for such a long time that now this is a point that I think people understand that we can emerge out of this as a way to address these issues and have some sort of solution to work on our disparities, which I think is the major lens of our students right now.
I mentioned you're also a member of the governor's vaccine allocation subcommittee. I have to ask, with this emphasis on an equitable rollout, what's your take on this age-based approach that the state is now taking?
I mean, it's really hard when you're in those meetings. We were on CTN advising him. So, I was an advocate for more of an equitable distribution and focusing on frontline workers and so were many of my fellow members of the committee. I can't speak for the governor himself, obviously, but I think the way they put it best was there's always going to be a pro and con to every situation and the rollout. But my hope is, and I think with our committee hopefully moving forward, we'll be able to work in a situation or in a function that will help address at least access and help monitor and kind of be a little bit of a watchdog, ensuring that we are addressing equity. So that's kind of my take on it.
Thank you, Tim. That's Tim Klufis, a recent public health certificate graduate from UConn Health, who is also working as a contact tracer. Jennifer Kertanis is still with us. She's Director of Health for the Farmington Valley Health District and Board President of the National Association of County and City Health Officials. Jennifer, we just heard Tim talk about his interest in public health, made some great points about the foundation of why it's important when we think about community health, and the idea that he's even working as a contact tracer. Are you feeling good about one of the silver linings in this pandemic, that there's more interest in public health and students like Tim who are taking this as seriously as the contributions they hope to make in the future?
Yeah, there are a couple of things that Tim spoke about that just warmed my heart. One, I'm very pleased that there are more individuals pursuing public health degrees now, because we know in public health we have an aging workforce. And we're going to need that next generation of public health leaders. Also, as someone who's interested in pursuing medical school, it just warms my heart to know that there's an appreciation for the community conditions that really are the foundation for public health and individual health. People don't question what a doctor is, but when a doctor, prescribes the best medication for a heart condition, but that individual is sent back into a community where maybe they don't feel safe exercising in their own neighborhood, or the quality of their housing is poor, or they're struggling to put food on the table, healthy food choices on the table because of food deserts in the neighborhoods in which they live. Those are the social determinants of health. And the best cardiac medicine in the world is not going to solve those problems. So it's public health working in collaboration with the healthcare system to really improve health in general.
It's good to hear that more young people are interested in public health. Is it a harder sell to get them to work at the local or regional government level, Jennifer?
I think we do have a challenge, and we're seeing that actually in this pandemic, is that salaries are not as competitive as the private sector. We have epidemiologists that are being, swept away to go work in the hospital or the healthcare arena because they can get more money. Public health nurses, even contact tracers across the country that are being kind of taken from the local public health system for private practice, temporary agencies even, where they can make more money. These are real situations that I'm hearing about from my colleagues across the nation. So we do need to, one, find ways to incentivize more of our younger folks entering the field of public health. And then we need to really look hard at compensation and equitable compensation for that workforce that's working in the public sector.
Well, this certainly has been an interesting hour looking at public health from the ground level up. Jennifer Kertanis, thank you so much. We know you're busy, especially with this vaccine rollout. Director of Health for the Farmington Valley Health District and Board President of the National Association of County and City Health Officials. Jennifer, good luck this week.
Oh, thank you very much, Lucy, and thanks for drawing attention to these really critically important public health issues.
Also, thanks to Tim Klufis for calling in today. Today's show produced by Carmen Baskoff. Our technical producer is Kat Pastor. We'll be back tomorrow. I'm Lucy Dalpathanchel.